So outside of the physicals, as far as reasons, as I just mentioned, you may have the simple colds. You may have, really, it's oh my goodness, it's such a vast array of complaints that patients can come in with. It's important to remember that the general doctor, the pediatrician, is usually the first one that sees the patient before they get to the specialist. So if you can imagine, really, they may come in for anything. Most of what we see, though, I must say, are upper respiratory infections, colds, so many ear infections. We diagnose so many of those per day. Sometimes kids are more athletic, and you may see joint type issues. Really anything head to toe the parents can come in or kids can come in complaining about. It's hard to say exactly. We just see so much. So a typical visit, it really depends on the type of visit. So physicals are very different, obviously, than a sick visit may be. Your physicals are very comprehensive. You pretty much want to know everything. And then in development is also an important part of what we do as pediatricians. So that really encompasses your physical. As far as your sick visits, you want to try your best to address the issues that they are there for. The child is sick, it may be a runny nose, maybe a cough, sore throat. Sometimes you have kids come in with more chronic things. They've had a stomach ache for a year, So those visits are more focused and more targeted on the actual problem. Those visits may take anywhere from 15 minutes to 30 minutes and sometimes longer depending on the complexity of the issue. And your physicals run on average around 20 to 30 minutes per physical. It may just be a case-by-case basis. If there's a concern that I have as far as treating a patient, giving vaccines, for instance, I think this is a situation I had recently, giving vaccines to a patient that may be immunocompromised. In that situation, I might need to contact infectious disease or any other specialist that sees the patient just to make sure it's safe. So we do have case-by-case basis where we do have to contact the specialist, but it's not something that we do daily. We do frequently make referrals, though. As I mentioned, we see otitis media so often. And I would say so many of our referrals are to ENT, those types of specialists. We live in an area where allergies are rampant, so we send lots of our kids to allergy and immunology. So we do make quite a few referrals, even if we don't actually one-on-one engage with the specialists ourselves.